Marcy Silverberg, you are a physical therapist and run your own physical therapy business. Please tell me more.
A physical therapist is an expert in the musculoskeletal system, so the muscles and the bones. And really, a physical therapist is the best one to help people if they have any kind of injury. So we could understand what caused an injury to happen and then heal it from the root cause. So not only do we work with healing injuries, but also preventing injuries from happening in the first place. And the way a physical therapist does that is by doing stretches and strengthening exercises, working with body mechanics, manipulating the body and massage in different ways, and teaching clients what they can do on their own at home. So I'll give you an example. I was in the clinic and someone saw me who had shoulder pain, right? So this is a common thing. This man had shoulder pain, couldn't lift his arm up. So he did what anyone would do. He went to the doctor, and then the doctor sent him to another doctor who's a shoulder specialist, and he got some medications and injection, but then he came to physical therapy. So in physical therapy, after the course, he had full range of motion of his shoulder. He had all of his strength back. He was able to do things pain-free because we were able to fix the problem at the root cause. And then he ended up not needing surgery or more injections or anything like that.
Do you have a specialty? And if so, do you treat people outside of that specialty or just stay within your specialty?
Yeah, I do have a specialty. So my specialty is in working with the pelvis itself, with women, and there are these really important muscles at the bottom of the pelvis called the pelvic floor muscles. So I work with those. Most commonly it's women during pregnancy, and then after pregnancy, these muscles and the whole core gets affected. And so they might have pain conditions or strength issues after having a baby, and I work with that. But that said, I've been a physical therapist now for 20 years, and I've worked in lots of settings. So I've worked in the hospital. I used to do neurorehabilitation. So I was working with people who had brain injuries and strokes. And then after that, I went into outpatient orthopedics, which is working with the entire body: neck pain, back pain, foot pain, you name it. So at the end of the day, I'm a specialist, but I treat the entire body. And oftentimes pieces are connected anyway. You know, so someone might have a problem with their core, but actually it's like an old hip injury that's playing into it. So you have to treat the whole body in order to help the problem from its root cause. So I'd say I'm a specialist and I treat the whole body as well.
Nice, that's great to hear. And you mentioned people may find out that there's actually more that could get helped. Do you find that out in a consultation, or do you usually find it out after a couple sessions?
Different ways. You know, when I work with people, I feel like it's like an onion. It's like peeling away layers of an onion of a person's body. So it's really common. They'll come to me with one complaint. So for example, I saw a woman who came to me because she was having knee pain, and that was her acute problem. She couldn't walk. She wanted to get treated for that part. But then as we worked together, it turned out that she also had weakness in her core, and she had leaking for many years, which was another issue that I treat in my specialty. So, you know, it reveals itself either in the evaluation or sometimes as I keep working with someone. But I think about it like that, like layers of an onion. And a lot of times there's old injuries in the body that end up coming up and we address. So however it happens.
During the shelter in place, are there ways one could do sessions from home, via computer, or how does that work? And can physical therapy be just as effective from home?
Yeah, it can. So since the shelter in place, I've been doing all of my visits through the phone or computer, and it's called Telehealth Physical Therapy. And it's been wonderful because people have aches and pains and injuries in their body, and those haven't changed because we're in quarantine. So over the computer, I can look at someone's alignment. I could look at how they walk and stand, how they look at their computer, and devise a program for them and be right there with them as they do stretches and exercises. And I've seen people really heal over the telehealth sessions. And I've heard people tell me that they're more productive now and they're able to do their jobs and take care of their kids and do what they need to during quarantine because of the telehealth sessions. So it's been wonderful.
Yes. And how can a patient start with you? Do they need a recommendation from a doctor, or do you take insurance? How does that work?
In the state of California, anyone can come see a physical therapist without having a recommendation from a doctor, because physical therapists are educated to diagnose if the problem is something that we fix or if the person needs to actually go to a doctor. But that said, I do work with insurances also. So when I work with an insurance, I do need a referral from the doctor because that's a rule from the insurance company.
Marcy, I'm in the Miss America organization and my talent is dance. Long story short, I began dance because I broke my back in gymnastics and needed to find a new passion. And it was actually physical therapy that really helped me and prevented me from having a major surgery on my back.
Mm-hmm.
But given quarantine and sheltering in place, I'm working from home a lot. Do you have any stretches that could really help me open up my back and help others open up their back from stiffness during working at home and sitting on a computer all day?
Yeah, I do. I have a favorite one actually that I can share with you. But before that, I was thinking about this, and what I'm seeing a lot of from people is they're working from home more now and spending a lot of time sitting at the computer. So before I would give any stretches, I just like to educate people that the body needs movement. We don't like to be in one position for a really long time. So I love to educate people about using standing desks, and changing the flow of the workday. So if you're taking a phone call, you could use a wireless headpiece and be up and walking, giving your body more movement. If you're just listening to something, why not go on the floor and stretch out your body in that way and just change the loads that you put on your body? So that would be excellent to just address stiffness, that alone. But that said, I'm gonna share my screen with you and pull up one of my favorite exercises. So when we sit for a long time, the back is in a position of being flexed. So in this exercise, I've put myself on my tummy, and then I'm going to be extending my back and giving my body the opposite of that, which is extension. And I'll also say that I treat every patient differently. Everyone has a different source of their back pain. So I'm giving this generic exercise. So this should feel really good. So if anyone at home tries this and it doesn't feel good or causes pain to shoot down the legs, then stop and consult with a professional. So it should feel good. I'm going to press the video. So what I'm doing is I'm just laying on my tummy and I have my hands under my chest and I'm just pressing my back into extension. I think about it like I'm just taking my back for a ride. My belly's nice and soft. And at the end of the movement, I just let all my air out and relax. And I'm moving my body in the opposite direction of what it's probably getting too much of. So that's that. I'll stop that share.
Thank you so much. That's so helpful. And thank you for covering the breathing aspect as well. It's so important. This is so great. Do you offer any classes or workshops for people that are seeking help during this time with extra stiffness or your specialty, as you mentioned earlier, and any other physical therapy needs?
Yeah, I do. So as I mentioned, I do a class for women who are pregnant and after. So I just did that one and I'll be offering it again soon. But next week I have a workshop coming up that is completely free and it's called Heal Your Core, Leak No More. So a really common problem that people have is actually leaking or urinary incontinence. And that's something that I could help with a lot just by educating people and teaching some simple exercises to do at home. So that's coming up next Wednesday at 2 p.m. And I could reference the link in that, or anyone could reach out to me to get the link for that class. And the other thing I do is I've been posting more videos on my YouTube station based on what people are telling me. So I've heard a lot of neck pain is happening. So I love to use balls and rollers and teach people to massage their own body parts. Like a lot of us are really wanting a massage right now. So on my YouTube station, there's a lot of self-release and self-massage work that you can look at too.